inflammation. What do we care about inflammation, and why did this turn into this panel? It didn't used to be in here. Because inflammation is the thing that's going to drive that little flap to break free to give you a stroke, a heart attack, a purple leg. It's just as important. Wouldn't it be nice to know if you have a genetic tendency towards increased inflammation? Mm-hmm. And we can do that. We do that. So then A1C and insulin, like this is A1C, insulin, and I don't know if I have it on this one. I don't have it on this one. It's something called C-peptide. So you know insulin, mm-hmm. right? But did you know that insulin, when it comes out of the pancreas, it actually comes out as a molecule called a proinsulin, okay? And what happens, shortly after it gets secreted, it gets cut, gets cleaved. Half of it is an insulin molecule, the other half is a C-peptide, okay? Okay. What's the relevance? Well, what if your A1C looks good? It looks like your blood sugar is always pretty low, but let's say, this is not you, but let's say this is your story, that you just kind of keep, your A1C keeps staying there, but over the last 3-6 months that you keep getting that A1C checked, it's staying normal, but your body fat is increasing. And your doctor's saying, well, you're still not diabetic, good job. Mm-hmm. What's going on there? Well, if we also took one step back further and we were looking to see, okay, how hard is your pancreas working, Chief, to keep up to regulate your blood sugar? Wouldn't that be important to know that if you're fasting and your pancreas is working really hard, well, it's making a ton of insulin, it's not staying around in the serum very long, so your A1C isn't going up, but it's zinging into your fat storage. Wouldn't you want to know that? Mm-hmm. Well, what do you do with that? Well, then we say, what are you doing with your nutrition? Are you eating too late? Are you eating the wrong thing? Do you know what macros would be the best for you? You know now how many calories you need from the resting metabolic rate, so you're at a good maintenance range minimum. And if you're working out harder, you can adjust from that and see how your body goes. But it's the big picture, and that's the tie into the cholesterol. This is a blood sugar byproduct of what goes on with your cholesterol, because your liver is constantly monitoring what's going on. And when you wake up in the morning, it's your liver that gives you that pulse of, you get your cortisol up, you get your adrenaline's up, and you get a bump of sugar. That's your liver.